Treasurer Rashid Mohammed, just cause of legal services.
Awesome. I'm Mike Weston, Executive Director of His Branches.
I'm Beth Kitts. I'm the Vice President of the board, and I work at U of R and St. John Fisher University.
Matt, repping the legislature.
Yep.
I'm Emma Forbes Jones. I'm in private practice. I'm charging her phone. So you're close. Yeah. Good. And we have several guests in the room, but I want to be respectful of your time. So we'll, I think you know, Dr. Acock though from the mental health. Yeah.
And online we have.
Oh, I'm sorry, Miguel Menendez. Yes, he had an emergency at work, so he's.
Sir, how you doing?
Good. How you doing, County Exec? Thanks for being here.
Nice to see you.
Yeah, we really appreciate you being here.
Oh, it's my
And I
pleasure.
am going to apologize because I have to present to the Highland board. Otherwise I would skip whatever
No
it is,
problem.
but I have to leave at 4. So
No
I'm just gonna
problem.
quietly inch out and Beth is gonna take over.
So Mr. Goldstein said hello, if he's
Yes.
there.
Absolutely.
Yeah.
Thanks for coming.
No problem. So, you want me to start, or do you want to?
So yeah, we
is that
were
right?
just, we hadn't touched base in a while, and I think the board was just wondering how you're feeling about health and what you'd like from us over the next year or two, and
Fantastic.
yeah.
Happy to help. So I appreciate the invitation to be here, and I'm glad that we had this conversation. I thought I'd start like maybe a little high level about some of what our priorities are, and then dive into a couple specific issues that we've been working on this year. But the way I think about county government and our jobs and our role here is especially a few years ago as we came out of the COVID pandemic, is I try to compartmentalize what our priorities should be. And the top priorities are health and safety, workforce development, and infrastructure, the investments we make in infrastructure, and we try to align a lot of what we do in those buckets. I firmly believe that health and safety have to come first, because you can make all the investments and parks is part of health though. We're gonna talk about that in a moment, but you can make all the other types of investments that you want, but our core responsibility in government is in health. I appreciate your service on the county, on the health board here. I appreciate your service here because this really gets to the core mission and function, and I want to thank you because I know obviously you're not getting paid to be here. This is a volunteer service. We really appreciate that. Also acknowledge our health commissioner, Dr. Mahdi. Thank you for your service as well. Dr. Acock's behind me because mental health is obviously an important aspect when we're thinking about community health. So I want to dive into a few priorities that we have this year, and then obviously get your feedback as well about things that are important to you as well. But would like to start off when we think about public health. One of the issues that's been important to us that we've been making a number of investments in over the last few years has been into the opioid crisis, and the county's response to that. We were not lucky, but we were fortunate to be the beneficiaries of some opioid settlement dollars that came from lawsuits against the pharmaceutical companies. That's given us a real opportunity to make investments. And one of the ways we chose to utilize those dollars is that you were only required to put a percentage of those dollars back into public health, into the opioid crisis and in response to that. And the rest of the dollars you could use at your discretion. What we chose to do as a county is put all of those dollars into a trust that can only be spent to the opioid crisis. If we're getting the dollars because of it, it should be spent back into it. That was a decision we made with our friends in the county legislature, with Albert and his colleagues. And so what we've done over the last couple of years is a few things. One is we started our impact team that was tasked with putting a few things. One is they do outreach efforts into right out into the streets where people live. We go to communities across the county. I had an opportunity last summer to actually walk Lyle Avenue with our team and interact with individuals who are facing addiction. and hand out kits, Narcan kits, other health, there's other health related things in those kits as well, and trying to, again, build relationships with people to move them into treatment and seek treatment if that's what they, if they're on that path, or provide some harm reduction strategies to those individuals. And so we call that our impact team. So we're out in the impact team doing that. Their other responsibility that takes up a lot of their time is the Narcan boxes that are, the naloxone boxes that are distributed around the community. We have nearly 600 of those, I think, that are really spread out. Businesses have them, they're in county parks. And it's been very successful. Tens of thousands of doses of naloxone have been put out onto the street. We do trainings on how to use it. And we, I think, are probably one of the most progressive, forward-thinking programs out there that any county has in terms of doing that. We have our hotline that people can call, and so it's a pretty robust program. We also have been working with our OMH team on a number of initiatives that they're going to launch here soon. We may be in a blackout period on how much we can talk about some of those, but really what we did was we utilized our research strategy team and our mental health team to look at what gaps might still exist in the system, things like transportation, things like that that people in addiction face that can prevent them from seeking the treatment or receiving the treatment, I should say, that they're looking for. And so we have a number of RFPs that will be going out related to that. So we're going to continue those keeping those dollars where they should be. And the other good news that we just did a couple weeks ago, because we were able to put those dollars in a trust and we had some dollars available, is that when the federal government cut one of the grant sources through the HHS department, which I thought, by the way, was not without irony. Just a week before they made those cuts, the Secretary of Health and Human Services redeclared fentanyl to be a national public health crisis, and doubled down on that, and then just the next week cut funding for addiction treatment centers. And Monroe County's only 24/7. There's a number who do obviously addiction treatment, but our only 24/7 drop-in center that's run by Delphi Rise was facing a severe cut that would have, by today, would have put them off of the 24/7 treatment. By the end of May, would have probably closed their doors. So we were able to step in and through an emergency action with the county legislature, provided them with the funding they need to remain 24/7 through the end of the year. When hopefully either things will straighten out at the federal level. There was a lawsuit that was filed, an injunction to prevent the grant from, so we'll see how that plays out, and then we can obviously do a full procurement for that service at the end of the year if that's what necessary. So I was very happy that we took that approach a couple of years ago, and keep that going. Another project that we're working on that impacts public health is related to a program that we created with the hospital systems and our nursing home partners called the TC3 program. It's a transformational community care coordination project, TC3 for short, that really looks to impact the condition in the hospital systems and nursing homes, where what we've had is a situation where, because the Medicaid reimbursement rate has fallen behind what the actual cost to care for a nursing home resident is, the number of nursing home beds that are staffed and available for residents has decreased. As of about a year ago, it's gotten a little bit better, but about a year ago, I think we had about 1,000 unstaffed empty nursing home beds. What happens when that happens is that residents of a nursing home who really should have a better quality of care in a nursing home end up being stuck in a hospital taking up an acute care bed. Well, an acute care bed that's being taken up by a nursing home resident is then not available for an acute care patient. It's also not the proper setting, and it also loses money for the hospital because they're not getting reimbursed for acute care. So what we, and then it mucks up the whole hospital system. So now you're boarding patients in emergency rooms. Any of our residents who've been to an emergency room in the last 2 years have seen this. So we use our federal dollars to create this program through the American Rescue Plan that would pay nursing homes to take cohorts of complex care patients from the hospitals to help cover that gap in cost, to cover their costs to take cohorts of patients or cohorts of 4 at a time. And through that program, we were able to move 535 complex care patients into 12 area nursing homes. It opened up an additional 169 beds and decreased the number of unstaffed beds. It decreased the wait time for hospital beds, and I think created this throughput. Now, unfortunately, the American Rescue Plan funding for that project dried up, and as soon as those dollars stopped flowing, the census in the hospitals went right back up again, pretty much to where they were all above 100%. So we went back to the state and had a conversation. I spoke to the governor's team a number of times, the state budget director and the state legislature. Spent a lot of time in Albany earlier this year, and the governor included $15 million in the budget this year to turn the TC3 program back on, which is a significant investment. That will make a massive difference. So as soon as the budget is passed, which I assume will happen any day now, those dollars would be available to us. We're working with Flips on that project. Carol Tagus has been leading that. And so we will, we'll be able to make a difference there. And then the other, even just today, we had an announcement that impacts community health today as well. And again, it impacts that system between nursing homes, hospitals, and the correct level of care. I was over at one of the churches in the city launching a initiative between HCR Home Care and about a dozen churches that will train people in the church to help connect their congregation and community, not just members of the congregation, but their community with home care needs, and also be able to connect them with counseling in terms of Medicaid, Medicare, veterans services to help pay for medical needs, to try to help people remain in their home and receive the home care that they need to prevent them from having to go to a hospital and prevent the residents from needing nursing home care. So again, it helps the entire system and helps keep the resident in the best place for their care. It also has a training component that trains home care workers as well. So that should help the whole system. And it works nicely with how we spend other American Rescue Plan dollars, again, with Albert's help. We have CNA training programs. Monroe Community Hospital has one as well to help train more healthcare workers. Particularly CNAs. We have a particular need in our community. That's also why nursing homes are struggling to open as many beds as they should, because they have to meet the minimum staffing requirements. And one of the minimum staffing requirements is so many hours of certified nursing assistant care. So we really just need more CNAs. In the mental health space, again, I want to give kudos to Dr. Aycock here. We launched less than a year ago our mental health app. Resource app, so residents, and this is something we can use some assistance getting out there and getting more people signed up. But I have the app right here on my phone. It sends me alerts too, which is wild. I even get weather alerts through the app. But here it is right here. So this Monroe County Office of Mental Health app that you have on your phone. Again, it's a good resource to connect individuals in our community with whatever assistance they need, connecting all the various resources that a lot of you are working in this space as well. Maternal health is important to us. There's an RFP that's out right now related to maternal health care because we're in the blackout period because the RFP's out. I can't get into a lot of details about that, but that's out, and I just want you to know that's a priority for us to make investments in maternal health care as well. Now I know the social determinants of health are also very important to the work that you guys do, right? Because it's, everything really affects the health of the community, right? So I want to talk about a couple of things that we're working on right now. One is related to, well, there's two related to individuals living in poverty. So the state of New York and the governor wanted to make a big investment here because We have some of the highest concentration of poverty zip codes right here in Rochester. Awarded our community $25 million. It's flowed through the county, but it's in partnership with the city. So Miguel, the team at the city are involved in creating this plan on how to invest the $25 million. We finally have sign off on how we want to do that plan. Again, we're out into the RFP process on a number of pieces of it. But on a high level, I can tell you the plan has we have three components of the plan. One is what we call our upward mobility navigation program, which is really a tool to help people maintain school attendance for households with kids, connection to primary care, healthcare, household stability is the goal, financial counseling. There's an initiative to provide monthly incentive program for expectant mothers to help work with new moms. And we also have a rental subsidy program, which is important. Again, housing stability is a huge factor, or instability, I'm sorry, it's a huge factor that's keeping people in our community in poverty. So it's for zip codes. It's in 1, 2, 3, 4. It's limited to 4 zip codes that are all located within the city of Rochester, and it's for individuals that are TANF eligible. This was funded through the state with TANF dollars. So it's a pretty significant investment, but working hand in hand with that investment. Again, this really has been talked about a lot because we're waiting for the budget to be passed. But Monroe County has also been singled out with a $3 million investment from New York State to work on something called the benefits cliff. Benefits cliff is a situation that a number of part-time individuals and even full-time individuals run into, where if they're receiving a public support, right? So whether SNAP benefits is a big one, Medicaid, things like that, where it's tied to your income. They face a situation where if they were to go from part-time to full-time, or if they were full-time and were to take a promotion, the amount of pay that they would increase is more than offset by the amount they would lose in that public benefit. And that provides an obvious disincentive because they would actually take home less money for that more work. And so we went to the state, and this is a national problem. You can see national studies on this. So we went to the state and said, we want to lean into this with a demonstration program that works with some local employers, some large employers, that would have employees that are facing this and provide a counseling session with the employee, look at where they may be facing this benefit cliff, get waivers from the state to then invest into that to keep them from falling off that cliff if they were to take the promotion, and then work with individuals to help them get promotions and get into full-time employment if that's what they want to do. It helps the individuals, it helps break that cycle of poverty that people are trapped into oftentimes. It also helps employers who are looking for employees, right? So this is a win-win really for everyone. So we're hopeful that, again, the budget will pass soon for that. We also are going to lean in this year with some anti-violence initiatives that are being run by through the health department with Dr. Mahdi. Again, my timing here is a little off because we're in the RFP process for that, so I can't dive too much into too many details with you all here in a public setting. But we also, but that is a huge, at the end of the day, we do view violence through the lens of public health, and we made a significant set aside again with our American Rescue Plan dollars to spend between now and the end of next year. And we've identified some priorities there. And again, we've gone out to RFPs, so you'll be seeing some investments there. And then, of course, I thought I should also mention too, when it comes to safety work that we're doing, we could talk about our JEDS program that we have that works with young people to keep them healthy and safe and out of the criminal justice system. We also have some safe streets initiatives that we've done over in my tenure here. The county's really changed its policy around bike lanes and trying to do some safety there to get people outside, right? Let's be able to utilize our infrastructure to ride bikes, either for recreation or get to work. And so we've been installing bike lanes around the community. We've made significant investments in the county park system. I'm a huge believer in public parks. We saw during COVID that the usage of public parks went up a lot, and I think it helps. Parks are good for your physical and mental well-being. So we've made really historic investments in the park system. And we also kicked off last fall a Safe Streets initiative, where we have really the one of a kind in the state. We partnered with Reconnect Rochester, the state, the county, the city, all of our transportation departments, to create this public portal where the public can actually report back to us areas where they feel like there's some engineering or street design or things where it's created dangerous situations out on the roads. A team then, professionals takes those. We've had over, I think, 300 submissions already since the fall. So they've been trying to prioritize and categorize them. And then we can work with our government partners at different levels to try to impact those street designs to help make our streets safer as well. Whether that's sidewalk, whether it's sidewalk, bike lane, straight up just infrastructure, we have a dangerous intersection. We have dangerous roads, right? You see them on the news like Lake Avenue, things like that, where it just seems to have a high crash number. We also invested in the bus patrol initiative as well, which puts the stop arm cameras on school buses to school districts that choose to partner with us on that. That, you know, again, it's about the health and safety of our children getting on and off stop school buses. And that's an interesting program to me as well, just because you always wonder, you see it a lot. Cars go by the school bus. Does it really happen a lot? Oh, it happens a lot.
Yeah.
So we have, I think we've handed out well over 10,000 tickets. It's a lot. And so actually, I'll say this, when you see the national statistics, and when we were doing this, when we launched the program, we quoted some national statistics about how often cars pass stop school buses. Those statistics are wildly off. They're way undercounting how many cars are passing stop school buses. And we proved it with the cameras. And so I'm encouraging right now the school districts that have not signed on to this program to sign on to the program. It's at no cost to the school district, no cost to the general taxpayer. It's funded through fines. And we're taking those fines. And those fines get reimbursed. What we do with the fines too, we don't even keep them as general revenue. I've made a commitment that when the program generates dollars above what the cost of the infrastructure, because the way it works is the fines first pay the infrastructure, the cameras. And then on top of that, we reinvest it back into public safety initiatives, back into those communities who chose to utilize the program.
Yeah.
So there's an incentive there. And so what some school districts have chosen to do too is with the they've chosen to take cameras and put cameras on the school buses as well. So with that program, so you know, it's in my view, that's all health. It's all related to health as well. So sorry, I just talked for half an hour. So I'm happy to take any questions or hear your thoughts. I can give you some more time than I initially said.
I have two quick ones if you don't.
Yeah.
if you don't mind.
Thank
Yes.
Oh, sure.
Please,
Thank you.
yeah.
Thank you so much. I appreciate
Thank you, yeah.
No, you're welcome.
Half of myself, all of them are on veterans, because leadership and support in the veterans area. It's very, very important to us. Sometimes we're an organization that doesn't necessarily get seen, but you've made sure to have some pretty robust support. So thank you.
You're welcome.
Thank you for that.
No, you're welcome.
Other thanks, Dr. Velez Brown, exceptional leader. That was a military person. Leadership is big to us. She's done an exceptional job.
Yeah.
And just want you to hear that from the public.
Thank you. I appreciate you. And I agree with you 100%. I think she's done a fabulous job leading the department. And I appreciate what you said about veterans. The ecotherapy program that we do out there. And also we just launched several months ago new satellite offices. So there's one in Greece at the mall. There's one in Webster Penfield, right on the border there, at the plaza, and they've been very popular. So they're
I have a question. On the school buses, has there ever been a thought of having the driver or the bus guard on the bus get out with like the vest and the stop sign and, you know, put it out so the kids can walk across the street? I know that at certain intersections, they have crossing guards, But I'm just thinking like, how many kids have to get hit before we'll do something like that? Where, I mean, it seems like that would be, because I think a lot of times it's distracted driving, people not paying attention, that you're not seeing the stop sign or the lights on the bus, and if you have a crossing guard,
Yep.
if a student is crossing.
Yeah.
I don't know what resources that would require.
Yeah, no, that's a good question. I suppose that is something we could probably reinvest in if the fines get to the level that could pay for. I believe that towns mostly pay for the crossing guards.
Okay.
They have that, and the school districts obviously do the buses. But that would be a logical next step, yeah. And I think that's what we're seeing on the camera, is that it's, because they review every ticket before it goes out. So there's a staff that this is all they do all day. And I think that's quite largely it, is distracted driving. Yeah, driving too fast, not paying attention, and then you look up and you're going past the school bus. We do have a very scary video of a kid just about to cross, like you just suggested, when a car came back. But I'm gonna try to show in the next month the video to sort of shock people to what's going on up there.
I guess my next question is, in terms of financial shifts and changes,
Yes.
what are we doing in our community to protect our kids who are part of the LGBTQIA, and then also our people with disabilities in our communities that may be losing funding and losing support in some of our health programs?
Yeah, no, I am deeply, deeply concerned about losing funding for particular most vulnerable communities here that rely on this type of funding. So what we've done is the mayor and our congressman and I have been convening. Really, the congressman's leadership brought us all together, but the three of us sit at the head of a group of stakeholders that we pull together. We meet every 2 weeks, and it involves different sectors. So different sectors of our community. It's not just nonprofits, it's schools, it's people who work with people with disabilities. It's people really from all sectors of the community. And every 2 weeks, we report, the congressman gives a really great report out of what the process is, because a lot of times we think there's a funding cut because you heard about a funding cut or a rumor of a funding cut, but it hasn't actually been cut. But that actually creates a lot of stress, and that's a huge piece of this is right now is the stress that people are facing. So part of it's informational sessions, they'll get information out. The other part is to assess what is going on with funding cuts. And there have been a number that have impacted organizations here. Lifespan has been impacted. I know with funding challenges for older adults, we've got the county health department lost 4 fellows that were working in environmental health and early intervention.
Trauma-informed principles and early intervention.
And so that's a strength, obviously. And then, Jerome Underwood at ABC just hosted our program this week. That's a severe problem. It has not been cut, but my understanding is in the president's budget proposal that landed Friday, Head Start was not in there. They eliminated LI Heat. There was this, the community, CDBG was eliminated. There was another program that ABC relies on for funding that would essentially jeopardize ABC's survival. The problem, there's a compounding problem with that. So when these kind of things happen, is that it's a proposal, so it hasn't become law yet, but also people work for these agencies that are providing this funding, and they see that their job is also on the line. So not only are the people that are going to be impacted by service cuts going to be impacted, but people who are also being paid that their livelihood are impacted, which then undermines their job security, which then undermines their ability to do their job, and it creates uncertainty. And I think in some ways that's the point of what's going on. Chaos is sometimes the point, and that's what's happening here. One other point I want to make. Medicaid, that also impacts these communities that you're referencing, and others. That's a real big problem. And Medicaid, I was in a meeting in Albany a few months ago when those cuts were first started being talked about. The loss to New York State at the time, if it's that current proposal, would have been about $8 billion a year. New York State can't make up $8 Who says nobody? And then if you were to push those cuts down to the counties, we can't make up for that either. And so there really will be service cuts. One of the things that I think is important, and that this is what that group is talking through, is that we need to have a better communication apparatus around that, because I think a lot of individuals don't really fully appreciate how much Medicaid is funding, right? So like the CDPAP program is a really good example. That's funded through Medicaid, and that would certainly be jeopardized, right, under that kind of level of funding cuts. But a lot of community-based healthcare is funded through Medicaid. And I don't think people fully appreciate that. So we have to separate, when we talk about what's being cut or what's being proposed to be cut, we have to separate what the idea of what programs are being cut or funding streams. Nobody knows funding streams or programs. We need to talk about what's the impact to our residents and the receivers of that healthcare. That's what we really need to talk about. And that's actually a way we can actually help and partner as well, is to talk about what those impacts are. Because even I, didn't appreciate, even through COVID, I've been the county executive for 5.5 years. We went through COVID together. We did all of this. Even I don't even fully appreciate until the federal government started talking about what cuts they would make, how much of what we viewed as state dollars are actually federal dollars that are passed through the state.
Thank you for all of that. That's helpful.
Yeah.
And our being will be having a nurses rally, so people are excited.
Oh, fantastic.
So a friend of mine gave me this question from the Group Policy Council. She was concerned about, she said for the last 2 years, she's been trying to find out what Rochester and Monroe County land management policies are, in the interest of getting them to make it their official policy to decrease the use of toxic materials on parks and playing fields. She said 208 people had signed a petition. And there's some more information here, but can you speak to any of that?
Oh, very high level. I will get information back to you through Dr. Mahdi, if that's okay. So we did change our county policy related to pesticide use in county parks. So I will get the specifics of that are escaping me. So I will get that to you, but we did. So I can get that back to you.
All right.
100%. No, you're very welcome. Thanks for asking. Okay. Well, thank you.
Can I ask you one more
Of course
question?
you can. Yeah,
Sorry.
yeah.
Before COVID, you had come out with a strategic plan or a list of health goals.
Yeah.
And I just wanted to know, would you revisit that? Where are you at with that right now?
Yeah, so no, that's a good question. COVID unfortunately took us straight into COVID, yeah. So a couple things. Number one, yeah, so COVID, and first of all, I appreciate all your work through COVID as well. I tried to be very intentional. I hope you saw this during COVID, is not to play doctor on TV. I let the health commissioner in the hospital systems, we always did it with chief medical officers, our briefings. I let them talk about the virus and the medical response. I talk about what the community government's response should be, and that's how I intend to keep doing this. I think that's how you also garner trust. So what we've done is before I became county executive, I did talk a lot in my campaigns about opioids, right? And so that was a big piece of it. So creating an opioid dashboard. We're also doing the fatality review team. I forgot to talk about that. That's a huge piece that's new that we're doing with our health department. Again, that's another interesting model to look at. So you're not just looking at big data sets, but you're actually working with families who've lost a loved one to an overdose, to find out what that person's journey was and their family's journey was through addiction, through potential treatment seeking. So that's another new initiative that we've launched as well. We also are doing in the process of updating the county's comprehensive plan. So that's where you'll see some more like health long-term goals. So the comp plan should be done later this year. It will talk about the environmental determinants of health, housing quality, neighborhood design, expanding health promoting features like parks, trails, things like that, community spaces. It will highlight preventive care initiatives, cancer screenings, immunizations, tobacco use, things like that. And it will also highlight integration of mental health services, particularly the expansion of strategies to address mental health provider shortages, integrating mental health services into primary care, things like that. So,
Okay.
so we'll make sure that you have access to that. It also talks about food, food availability, things like that. So we're working on that.
Okay, thank you.
Oh, you're very welcome. Well, thank you all very much. I appreciate it.
Thank you.
Thank you, Brandon.
I did most of the talking, I apologize. But yeah, but we're doing a lot. I'm very happy. I gotta tell you, we didn't, before I took this job, before I was fortunate enough to have been elected to this job, we talked about, most of what I talked about in terms of what you think about as public health was our opioid work. But since COVID happened, really drove public health to really be a priority for us. And opened at least my eyes to, and the community's eyes to all the various things that play into the community's health and just how important that is, because like I said, you can't have a strong workforce unless you have a healthy workforce. You can't have a strong educational system unless your children are healthy and have access to health. Even working with the Rochester City School District, aren't we? Pushing in mental health resources into a number of schools in the city school district as well. And I think those are all things that are foundational. If you think about the needs that people have, if you don't have health and safety first, you're really just not going to be able to meet the rest of the needs of the communities. And all this, even the parks investments, are really about health, right, at the end of the day. I appreciate all your work. Thank you. Thank you for agreeing to do this. You're doing this. I look forward to continue working with you, seeking your advice and counsel. And I know Dr. Leslie Brown appreciates your response.
Thank
Well, let's get on to the rest of your agenda. Thank you so much. I appreciate
You.
Nice seeing you.
Thank you, Ms. Melendez. President, thank you. All right. Good to see you. All right, take care. All right, thank you.
Yes, sir.
All right,
Thank you.
thank you. Appreciate you. Thanks for being around. Appreciate you. Yeah, always. Thank you. Good to see you. Lovely to see you, Albert. All right, thank you. Welcome aboard. All right, you're welcome.
My daughter Martha.
Oh, very nice to meet you. Oh, is that right? What year are you in high school? You're a senior. Oh, do you know what you're doing yet?
Fashion.
Very good. Congratulations. You're almost done. You only have like a month left. You're so close. Well, let us know if you need anything. Thank you so much. Appreciate you. Thank you. All right. All right. Bye, everybody. Oh, hey. Thank you. All right.
Don't forget
All right. And Brendan, you too. Sorry. Okay. Bye, everybody. Thank you.
Okay, move on to our commission report.
Yeah, I figured it'd be a little bit shorter today, because we were gonna talk about a lot of other things. So as the county executive mentioned, we did release all of our ARPA related RFPs. The one is focused on maternal child health. I will just say it is a very broad invitation for folks to let us know how do they think their entity, their agency, what can we do maybe differently, what can we maybe expand to try to decrease the number of negative outcomes associated with just being pregnant and laboring in this county. There are significant disparities that I think we've all shared, but since now we're streaming, Black women are still 4 times more likely to die or have a negative outcome compared to white women of same socioeconomic status, same educational status, and so those kind of disparities are the things that we also are hoping to address and inviting folks to tell us how we can best partner and where we need to invest.
Sorry, where can we find that?
I will include a link to the county procurement page.
Okay.
Where folks, there's all kinds of RFPs on there for lots of things.
Okay.
The ones related to health are the maternal health, and then there are 2 related to violence. So violence prevention generally, what are folks' ideas, and then our health department is planning to become a type of a training center where we can help equip other agencies that are doing anti-violence work. So we're seeking proposals for what entity will do the training and then train the trainers so that our our Department of Public Health can continue those trainings for future folks. So that's thinking through, how do we give skills around the supervision of groups that are gonna go out and walk the streets and talk to folks that have just had a shooting occur in their neighborhood? Or how do you support your staff through that idea of secondary trauma? How do you build rapport? How do you just do this work safely? So those are the kinds of trainings that we're hoping to be able to offer long-term, even once the ARPA funds have been exhausted.
So is there a deadline that you have to respond?
Yes, they each have different deadlines, so
Okay.
I will make sure to make a note to send that link, and
Thank you.
Terry Lynn will get it out to you.
I have a question. When we think about maternal health, does that include mental health care after the loss of a pregnancy, or would that fall into a separate category?
I don't see a reason that it couldn't.
Okay.
I'll have to go back and reread some of the details.
Yeah.
But I don't see why that
Okay.
couldn't be involved as well.
Yeah, but I think it's probably more the, the blood pressure, if you, the pre-assigned,
Yeah,
you know,
yeah,
the hemorrhages. I
yeah.
think that's the focus. but-
Yeah. I had a student that she did her research question on loss of pregnancy and the health care that people get after that loss. And just found that in so many cases, it was just lacking. And I wanna know like where that would fall, or like, in terms of like what we do in our area to care for our mothers after they've lost, experience a loss, and where funding for that would come from.
Yeah, I think it is primarily focused on
Yeah.
preventing those losses
Yeah.
and preventing and addressing those disparities.
But I think for the maternal health piece, and when you think about deaths, it goes up to 1 year. I mean, the risk is still like
It's one year.
33%.
Yeah, okay.
The initial percentage after delivery or from pregnancy is like, I think 31% or 33%. I think it's the least when you're pregnant. 31% after you deliver, the percentage goes up to about 36%, and then up to a year, it's still 33%.
Okay.
So along that whole trajectory for a year,
That's
you're at
helpful.
risk. So I think anything in that
Yeah.
continuum,
Well,
okay, probably.
Thank you. Thank you.
Generally, people do a referral to a mental health program.
Yeah.
If it is something that has to do with loss, yeah.
And I feel like it's Star Legacy, or there's a group that specifically works in that area. I don't remember why I know that name, but I'm
Yeah,
pretty
they-
sure that's
Yeah,
who they are.
yeah, pregnancy and the loss.
So there are entities out there doing that work, but of course, you have to hope that your provider already knows about it
that.
and
Yeah.
is even willing to make that referral and
Yeah.
all the busyness of, everything, so.
Yeah.
There are definitely needs there. So the RFPs, we've had a significant increase in the number of birth certificate requests recently. All of that mostly related to the real ID requirement now for traveling in specific ways. We've had like triple the number of requests as usual, and so our staff are busy over there. We're actually listing some temporary assistance and trying to use very, very limited funding to address that need that folks have. So that's one of the few revenue generating ways that tools that we have in our department. A lot of our work is mandated by the state, or that some of that is unfunded mandates. But vital records, it's certainly cheaper to request your birth certificate through your local county than writing to Albany. So anyone that you know of that is in need, our staff are hopping over there, but we are meeting that demand.
What would be like the timeframe to get it?
Well,
I have no
so-
idea what the process is.
I think the typical within a week, but certainly if folks want to pay an expedited fee, we can overnight FedEx kind of things as well if someone has an urgent need.
It is absolutely quick. It's quick. I did it and it was like, oh, wow. So I don't even think it was 2 weeks. I did it right online, paid for it online.
Right.
But you have to be born in this county, right?
Right.
So like I was born in
So-
Queens, so.
Yeah, so you do have to
Different
request.
timeline.
I'm still waiting for mine in Brooklyn.
Yeah.
You're waiting for yours.
Right.
Monroe County stands out again.
I'm like, vital records, so that's gonna be a while.
To be clear, you request your birth certificate from the place where you were born.
Well, Jamaica, I called you guys.
Oh, yeah, you're not getting it.
I was gonna make a joke about like Philly, but you know, you got anything in Jamaica, yes. So that team is quite busy over there. And then, one question, kind of request for help from you all that I would make this month, is concerning, we've had some pretty serious personnel issues brought up. We're trying to disseminate this trauma-informed principles into all the work that we do. So building psychological safety, physical safety, empowering staff to then empower clients and patients that we're serving. I hope all of you by now know about trauma-informed principles. And so this has, I guess, helped folks feel like they are at liberty to disclose some really unacceptable behaviors that I had no idea were taking place. And so I want to be able to bring in a training, a speaker, a seminar, something that can really, I'm focusing on my middle managers, who are the ones that are supervising frontline staff, whether that's nurses in an FP or clerks or sanitarians, to just create a culture of psychological safety where people don't tolerate being berated or yelling or racial, gender, fat phobic joking. Like, how do we change this culture? I mean, certainly the culture has changed significantly from decades past. I think, nobody would stand for like a pinup, thing to be posted in someone's cubicle anymore, or shouldn't. So that is progress, but I've just been really saddened to realize that some of my own staff in my own department, where we're talking about trauma-informed principles, are just tolerating stuff that I surely would never tolerate. How do you all know of any resources that we can bring?
I was gonna say, so our department actually, on a quarterly basis, we bring together all of the supervisors across the department. So it's like 40 people, a lot of people. And we do like quarterly trainings. We're actually in the middle of like a sort of a self-assessment culture of our department, like work with a consultant who's like coming and doing staff surveys and focus groups and things like that. But I think it's really, even at the city level, like all of the sort of folks that are like deputies or assistants also come together on a quarterly basis. And I think that's really helped with like morale, but just because it's like, if I need something from another department, I know who to talk to, but I think within our department too, it's good because it's sort of like our commissioner sets the tone for anyone who supervises anyone else, like what the expectations are. So I think I like it, and I think it's pretty effective. But that's something to think about. It's a lot. It's like we do, maybe 2 to 3 hours once a quarter, and it's every single supervisor across the whole department.
And is it HR that coordinates, or?
Nope, it's the commissioner, my boss, started it, and she's the one that continues doing it. So,
do you want more advice on like professional behavior or trauma-informed care resources?
I wouldn't turn away either.
Oh,
I was really thinking about like the professional development.
Okay.
I can't be everywhere, right?
Yeah,
So
right.
how do I set that tone and then have my managers go out and empower everyone to intervene when you overhear a joke like, that did not sound appropriate, and be able empower my staff to feel like they can go and not have to, let's take it up the chain, and do I feel safe? Maybe I'll just go talk to, 3 levels up, which is fine. I mean, I want staff to come to me too, but it shouldn't have to get to them.
My husband works in HR, and that's a lot of the work that he does with managers. And so I guess I would ask, what's HR's role here in bringing some of those trainings?
Just emailed them today, so it's not that they are delinquent. I was just wondering if any of you knew of any other resources, and I should have reached out
I was
to
gonna
you.
say, like, I probably, my office, so the DEI office is where I work, and my role is staff development and ADA manager, so I would say some of that, and what I tend to call it is civility training, and SHRM calls it that too, so the Society of Human Resource Management. It's sort of like one step before you need the trauma-informed level, but like sometimes the trauma-informed information, folks are not ready for that because we actually can't even be civil. And so we hate to say that out loud, that we have folks who might struggle to just be civil. But there are areas where that's where we're at, and we just have to kind of accept that and go. So I can do some civility trainings, but Cheryl Hayward, I work with her, so and she, she's incredibly busy too, but so I can't volunteer my coworker, but she can do some of that. Here, and we were working with your intern who that was ouch, what a loss. Because I think it's a value, but also there are people from the outside, obviously, that can come, but if I can be of help, I'd be happy to.
And I do quite a bit of, I do quite a bit of this anyway, if you've seen my, yes, I think that, about this, but I could probably be a conflict of interest, but I'm always willing to do, because I curated something called, like a workshop, how organizations de-identify Black women in the workplace, and it's called Identity Theft at Work, and it really talks about how these collective behaviors, don't be writing it down, it's trademarked, okay? You over there, don't try it. Yeah, go write it down.
I'm looking up your TikTok, are you with me? I'm like, let me see what the TikTok.
We're really talking about those collective ways of how people with your identity. And in that, we talk about psychological safety and different things, but we do it in a workshop way. But yeah, I can find some connections too. Yeah.
I think there's a lot of restorative justice practices that a lot of organizations are bringing people in to do that with small groups, to really talk about, how to speak up and so forth. And then the psychological first aid. So our department does some of the training too, but you can also get the state to come in and do the psychological first aid.
Separate
It's
from
not gonna-
mental health first aid, right?
Yeah, it's very much, separate from that, but the psychological first aid, and then again, that can be bought in through the state. If you prefer that one or our office training, but the restorative justice practices is what I'm hearing is really good with checking in with each other, making sure we're good. Did I do something wrong? What's my mood today? Who can I go to for support if I need, some help and support? So it really is a really good practice.
And I mean, that's not to say we have our annual harassment trainings, we have those things.
Right.
And still, some things have recently been surfaced, and I'm like, I
Here-
never put
Yeah.
that. So how do we?
All workplaces,
Yeah.
especially right now. So, but I do wanna, I know you had a point, but I do wanna say that it's honorable or it's good that they're even coming to you and letting you know the information, so they kind of feel
Wasn't
safe.
good.
Well, to
To the folks
whomever,
that we
but
have.
they felt safe enough to talk to them, and I think that's a big step. So creating that space for them to even have someone that they can go to and say, hey, this is what's going on. But just experiencing that is very traumatic.
Yeah. Okay, thank you.
Yeah, and I was going to came first, but restorative justice types of practices, because it reminds me a little bit of what they call in schools upstander training too. Like you're not just a bystander, you gotta learn how to speak up. And I think a lot of times, especially in that kind of middle management, that's not like, where do you learn that?
Yeah.
Right? You learn how to be a good worker and you learn, but you're not learning kind of the more the softer kind of supervision skills.
Yeah.
And therefore you can't teach it either. So it sounds like there's more than that going on, but upstander training is.
We also brought in Andrea Hollins, and I did it with all of my top leadership team, and we did a little bit of workshops, but then I did individual sessions for some of the team. I specifically pointed out some areas that I wanted her to work with them on. And then we did a couple workshops for mid-management too. And we had something called a huddle, which we brought up different topics to talk about how would you do a quarterly, report out? How would you do how would you deal with a conflict? So we came up with different topics and talked through it. So at least they knew the tools to use if they were in these kind of situations. And it went pretty well.
I feel like the sexual harassment training, because you do it so often, sometimes it almost feels like you're just checking a box to get it done. So I think like they're recommending a workshop of some sort where you're actually, people are engaging in conversation and back and forth is a good way to handle something like that.
Thank you so much. That was what I was going to bring to the board. Yes, so thank you. Mr. Alton.
No one that's on the nominations committee needs to be.
I am.
Oh, no, sorry.
But I only have an update, so. As far as I know, we don't have any nominations, is that correct? Correct, so I don't have an update. Okay. All right, that's an update.
Okay.
But so I guess, just to flesh that out a little bit more.
Yeah.
So it was, I don't think it was posted online. Like we had requested. The fact sheet was posted online, but not like the deadline. Okay.
Was not able to issue the press.
Okay, the press release, I understood, so there's a press release, but I think what would be helpful, because again, we are gonna lose at least one person soon, we will make a deadline, but.
Okay, the member whose term is expiring will continue until the vacancy is filled.
Okay,
That's how we did it with Joe and Bill.
okay, so, I mean, what would be?
You're here.
Unless Ben is, unwilling to,
No.
but the bylaws and charter
Okay.
do provide for that.
So what? I mean, what would be helpful, like just sharing our own network?
As far as I know, it will not be.
We can't have even like we're looking for people on the website.
I am unclear on that.
I will clarify. I thought we were going to move forward with that, but I will confirm.
Because that way, like, I guess we could just share it, like,
Where you
hey,
can
go
have it.
online,
Yeah.
right? Like, that would be
Here's the
the,
website. that
yeah,
explains it.
yeah. So you can follow up on that? That's great, thank you.
And just a reminder, I'm an at-large position, so broad, anyway. And I think that's what we said we would like as somebody outside of healthcare maybe.
So please, when you see the email, forward it. Thank you.
What's our response to Executive Fellow's presentation? Thoughts on that? Were we glad that he was able to come and yeah.
Very happy.
Yeah. I was glad to hear that they're coming up with a new plan that, because he had very clearly outlined specific things that his committee was gonna be working on, and then COVID happened and everything fell apart and we never heard about it again. So the fact that he's recommitted to that is a good thing.
I'll say
that. Yeah.
I'm sorry, go ahead, Miguel.
No, I was gonna say, I agree with that too. I think coming in, there was a huge focus on the opioid epidemic. So I think I'm looking forward to that continuing. I'm hoping that in addition to the comp plan, there's a renewed energy around what more could we be doing. I know that the city and the county is having a lot of conversations on that. But certainly our numbers are still a challenge, right? In terms of the number of overdoses and the number of deaths. So I think as we get to this place where COVID is not the main topic on the agenda, let me not jinx that, but You know, I think the renewed focus on the original priorities is something that the community, I think, is in line with too.
Yeah, I was gonna say, I very much appreciated him taking the time and his willingness to come here. I think he probably gave me more credit than I was due, by referencing the legislature, as 1/29th of that body. But one of the things that I really appreciated in hearing him reflect upon is both the inclusion and the understanding of the social determinants of health, and how huge of an impact they have on people's health outcomes. And, you know, obviously by having Dr. A here and engaging the acknowledgement of how important mental health is as part of that, and that so often is intertwined with substance use and the challenges that go along with that. So I think it is a good sign to have someone in that type of a leadership role that's willing to expand that definition, and have a good sense of that, and to hear him talk about things like parks as having an impact on health beyond necessarily just the direct environmental impacts, but all of those things is a positive sign.
Any other thoughts on that? Oh. Was that a comment from Linda or?
Oh, no.
Okay.
I was just saving the transcript.
Oh, okay. So the only other topics that are on here is, so in June, the possibility that we'll get to revisit the race communication. I don't know if Teresa was planning on bringing them back or,
Full disclosure, I'm gonna have a meeting with them to try to level set, like, here's what the Department of Public Health actually does.
Yeah.
And here's what we don't have any power over. We don't regulate nursing homes and hospitals, which is a common misconception. And I can't find it on my, this one. Right, great. That's happening on Thursday. Maybe I found it now, sorry. So hopefully that will help set the groundwork for having a more productive conversation than the last time.
Okay. Good.
Thank you, yes, it's on there.
Okay. And then it looks like our future meeting is a summary of the community health improvement plan. That's Teresa, right?
Yeah. Yeah, the final submission.
The
She's
final
presenting
submission,
them.
okay.
So the chip has to be presented to the boards of all the 4 hospitals.
Okay.
And basically make sure that they are bought into the priorities that the community.
Now.
Yeah, she's
Okay.
presenting the timeline for it right now.
Okay. And then as we think about usually summers, for any new members, usually summers, we adjourn for a little while and then meet back up again in September and the fall, unless there's a reason for us to call an impromptu meeting. So I believe would that June meeting be the last one before we?
Right. Unless there's like an enforcement action that we need to take, but these tend to be very focused meetings in the summer when folks are here or not, or on vacation and things like that.
Okay.
And I'm not aware of any enforcement actions that will happen between now and September. There's one we're trying to schedule for September.
Okay.
So there might be something in September or October.
Okay, all right. So besides that, does anyone have any other final thoughts before we?
I do. If you know anybody who needs to go to the hospital for psychiatric concerns, please encourage them to check out Rochester Regional. Right now, Strong is on diversion. It's over 47 people and 12 warnings, so they are really, really busy with a lot of individuals. Don't know why, don't know what's going on. The only thing I can contribute, which is not scientific at all, is that the movie Sinners came out. People are scared. Vampires. Maybe that's why, but no, all jokes aside, try to encourage them to utilize other services, use our app. There's other locations such as BHAC. I wouldn't even go to Rochester Regional. BHAC on Genesee Street would be great for them to get mental health and addiction support as well. So if you know anybody, pass it in your network. So please don't go to the hospitals right now because you will wait. And if you go there and you go behind a locked, secure door, you are not getting out until you are evaluated. So that could be 3 days So if you're looking to do something over the weekend.
Is that CPAP or is it for kids too?
Yeah. Or straight up, yeah.
Oh,
And CPAP have kids and so if you have somebody and it's a child, have them go to Brighter Day. Brighter Day, right on Creighton, it's gonna be better. Because that is kind of like the urgent care for kids, go there, but shy away from the hospitals right now. I would recommend you call our office if you need some other information as well, but really the app is gonna really be a good direction. Mental Health Association has walk-in hours, so you can go there. We have a program that's severely underutilized, which is Villa of Hope psychological living room model, which again provides the support for people, but it's underutilized. So that's it. Go there.
I'm trying to remind everyone what BHAC stands for. Behavioral health.
Behavioral health, like acute clinical something, yeah.
It's Rochester Regional's
Yeah.
urgent care for psych,
It's
yeah.
urgent care, yeah.
Not
Behavioral
hospital
health
based.
access and crisis center.
Thank you.
Thank you, Dr. Gillespie.
You can walk right in. You can walk right in. There's no issue if you walk right in.
Well, I think it's a transition time, right? Like school is ending and I think that's when mental health issues like kind of peak up is like you're gonna go through a change and you're afraid and most of the folks that are there right now are adults. Oh, adults. But so
Their
maybe
kids
they're
are
like,
like,
my kids are coming home.
The water bill, the urgent need of food, they're gonna get on my nerves.
And the weather.
Going to college.
The weather's been.
Well, I thought that it was going to be because the heat sometimes increases the numbers too, but it hasn't been as high, so. But I just wanted to give you that FYI, please don't go there. You can tell them
Dr.
that.
Aycock,
Hey,
hey, Villa of Hope, is that for all ages or is it just for youth?
it's for adults. It's for adults. They're in the process of doing a youth one.
Okay, thank you.
Download the app. I like the lipstick. We can't hear you. You're on mute.
That's good. Yeah, people have been talking about my lipstick today.
You don't normally wear lipstick. Uh-oh.
I always wear lipstick, but this one must be really popping, so.
Do you? I did not. That's popping.
Zoom.
All right. Anything else? Can I have a motion to adjourn? Second. Those in favor? All right, we are adjourned. Thank you, everyone. Thank you.
No, I thought that.
Were you there?
Weather there this time.
My son came home from college and it's like, it's been terrible. Oh my God, no, I love it.